3 trips to the bathroom before dawn, then standing there waiting for a urine stream that will not start, is not something a man over 60 should automatically write off as just aging. Prostate cancer is diagnosed in about 1 in 8 men. About 6 in 10 cases are found in men aged 65 or older, and the average age at diagnosis is about 67. The most important number may be this one. When prostate cancer is found while still local or regional, 5-year relative survival is greater than 99%. When it is found after it is spread to distant parts of the body, that drops to about 37%. That is why small warning signs matter. What makes this tricky is that many of these symptoms are real warning signs, but they are not specific to prostate cancer. An enlarged prostate, also called BPH, can cause many of the same bathroom problems. For a lot of men, the first losses are not dramatic. They are daily life losses. Broken sleep because you are up urinating 2, 3, 4 times a night. Less energy the next day. Less patience. Less interest in going out because long drives, golf rounds, church services, and dinner with family suddenly feel like planning around the nearest bathroom. You start saying no to things. You move a little less. You feel a little older. And because it comes on slowly, it is easy to tell yourself, this is just what happens after 60. The first sign many men notice is frequent nighttime urination. If you are waking more often to go, especially if that is new or getting worse, pay attention. The second is a weak or interrupted urine flow. The stream may feel less forceful, or it may stop and start. The third is blood in the urine. Pink, red, or cola-colored urine is never something to ignore. The fourth is blood in the semen. Some men feel embarrassed bringing that up, but it matters. The fifth is pain in the hips, or lower back, or even stiffness in the upper thighs. That can have many causes in older adults, but new bone pain can be a more concerning sign, especially if it lingers. The sixth sign is difficulty starting urination. You stand there, wait, strain, and nothing happens right away. The seventh is painful ejaculation. That is more suggestive of a prostate or urinary tract problem, even though it is not automatically cancer. And the eighth is unexplained weight loss and fatigue. Those last two are less likely to be early localized prostate cancer and more concerning for advanced disease or cancer in general. There are also a few changes that often travel with these signs. Feeling like your bladder does not fully empty, trouble stopping the stream, taking much longer in the bathroom than you used to. These are the kinds of symptoms that spouses often notice before men admit them. Here is the truth that can save a life. Early prostate cancer often causes no symptoms at all. So symptoms matter, but waiting for symptoms is not a perfect safety plan. If you are over 60, especially if you have a strong family history, inherited BRCA gene changes, or you are a black man in the U.S., it is wise to have a screening conversation with your doctor rather than relying only on how you feel. And some signs are not home remedy situations. Blood in your urine, blood in your semen, new pain in the hips or back, unexplained weight loss, persistent fatigue, or urinary changes that are new, worsening, or truly disruptive deserve prompt medical evaluation. Food can support health. Walking can support health. But neither one should be used to delay getting checked. Now for the part that gives you some control back. No food has been proven to cure or reliably reverse prostate cancer. But a food first, it supports metabolic health, helps with weight control, may lower inflammation, and fits the broader lifestyle linked with better prostate and heart health. The simplest pattern looks a lot like a Mediterranean-style way of eating. More vegetables, more legumes, more whole grains, more nuts and seeds, healthier fats like olive oil, less red meat, less processed meat, and less ultra-processed high glycemic food. That is not a trendy diet. That is a practical daily pattern. Start with cooked tomato products. Tomato sauce, cooked tomatoes, and tomato paste contain lycopene, a carotenoid with antioxidant properties. Processed tomato foods make lycopene easier for the body to use than many raw forms. Observational studies have often suggested lower prostate cancer risk with higher tomato intake, especially tomato sauce, though this is not strong enough to call it a guaranteed prevention tool. A reasonable approach is simple. Include cooked tomato foods regularly, several meals per week, as part of a plant-forward diet. Use extra virgin olive oil more often. Keep walnuts, almonds, or pistachios around for a simple snack or salad topping. These foods fit the heart-healthy pattern associated in some observational work with lower risk of aggressive disease and help replace heavier saturated fat foods. That matters because many older men are not dealing with only one risk. They are dealing with prostate concerns, blood sugar issues, blood pressure, and heart disease, all at once. Garlic, onions, and leeks are worth adding too. The evidence there is suggestive, not conclusive, so no miracle claims. But they are easy, inexpensive, flavorful, and fit the same overall pattern. Just as important is what to cut back on. Processed meats like bacon, sausage, hot dogs, and deli meats do not belong at the center of a prostate-conscious diet. High glycemic refined foods like sugary cereal, white bread, pastries, soda, candy, and oversized servings of fries or chips are also worth reducing. One study linked higher intake of high glycemic foods with greater risk of aggressive prostate cancer. And even apart from that, these foods work against weight control and stable energy. Large amounts of dairy may slightly raise risk, but the science is not settled, so there is no need to fear normal amounts. The same goes for calcium. Normal dietary calcium should not be demonized, but very high calcium supplementation without a medical reason is not something to do casually. Movement matters too. A strong starting point is 20 to 30 minutes of brisk walking most days. If that feels like too much, start with 10 minutes after meals and build from there. Add light to moderate resistance training 2 times a week. That helps protect muscle, balance, and independence, which become even more important if treatment is ever needed. If you smoke, stopping is one of the clearest actions you can take, because smoking is linked with worse prostate cancer outcomes and hurts nearly every other part of health. And for symptom relief, not cancer prevention, pay attention to hydration timing. Stay hydrated during the day, but if nighttime urination is a problem, avoid large fluid intake in the couple of hours before bed. The goal here is not fear, it is clarity. If you are getting up all night struggling to start urinating, seeing blood, dealing with new back or hip pain, or losing weight without trying, do not brush it off. Get it checked. Then support your body with the kind of food and daily movement that protect energy, strength, and long-term health. This week, do 3 things. Notice your symptoms honestly. Put 1 plant-forward meal on the table with beans, whole grains, olive oil, and a vegetable like broccoli or cooked tomatoes. And take a walk, even if it is only 10 minutes after dinner. Small actions count. Quiet symptoms count too. And catching a problem early can protect a lot more than your prostate. It can protect your independence, your mobility, and your time with the people who need you here.